You know, a baby's heartbeat, it's one of the very first, most powerful signs of life. But during labor, it's so much more than that. It's a constant stream of communication. Today, we're going to explore electronic fetal monitoring, the technology that translates that heartbeat. And we'll also look at what happens when that translation fails, because the consequences can be absolutely devastating. And this quote right here, it just gets to the absolute heart of the issue. So many of these devastating birth injuries aren't just tragic, unavoidable accidents. They're the result of a communication breakdown. It's a failure to correctly interpret the baby's voice, right when it needs to be heard the most. So, to really get a handle on where things can go wrong, we first have to understand the basics. What exactly are doctors and nurses looking at on those monitors? And what does a healthy signal even look like? Okay, so electronic fetal monitoring, or EFM, is standard practice in most delivery rooms. It's pretty straightforward. It tracks the baby's heart rate and the mother's contractions at the same time, printing it all out on a long data strip. Now, this strip is supposed to be a crystal clear, real-time window into how that baby is doing, showing exactly how they're coping with the stress of labor.
Now this right here shows you the crucial difference between a baby who's doing fine and one who's in distress. Over on the left, you see a reassuring pattern. The heart rate is in the normal range, yeah, but look closer. See that jagged, almost chaotic-looking line? That's called variability, and it's a great sign. It shows the baby's nervous system is active and responsive. But now look to the right. That beautiful variability is gone. A line that's smooth or flat like that, that's a huge red flag. It's a sign that the baby system is under some serious stress.
So what happens when that healthy pattern disappears? Well, a baby who is in trouble sends out very specific distress calls through their heart rate. Let's decode some of those most critical warning signs. First up, we have late decelerations. This is a big one. It's a dip in the baby's heart rate, but the key word here is when it happens, after a contraction is already over. This isn't just a reaction to being squeezed. This is a sign the baby is struggling to recover, and it strongly suggests the placenta just isn't delivering enough oxygen. Remember that healthy, jagged line we just saw? Well, this is its dangerous opposite. A smooth, flat line shows what's called absent or minimal variability. A lot of experts call this a silent emergency. Why? Because it means the baby's nervous system is just so exhausted from a lack of oxygen that it can't even regulate the heart anymore. The baby is essentially running on fumes. Next is bradycardia. Now this one's pretty straightforward, but is very serious. It just means the baby's baseline heart rate is too slow. It's dropped below that normal 110 beats per minute, and it's staying down there for a while. It's a clear signal the heart is starting to struggle. But when that bradycardia gets severe, I'm talking dropping below 80 beats per minute and staying there for 3 minutes or more, it's not a warning sign anymore. This is a full-blown medical emergency. It points to severe oxygen deprivation and puts the baby at immediate risk for brain damage or even cardiac arrest. The clock is really ticking. And then on the complete other end of the spectrum, you have tachycardia. That's a heart rate that stays consistently high, above 160. Now this can have a few different causes, but it can also be an early sign of hypoxia, because the baby's heart is starting to work overtime trying to compensate for a lack of oxygen. So the technology is there. The warning signals are often pretty clear, which brings us to the most critical question of all. How are these signals still being missed, leading to these devastating and preventable injuries? It almost always comes down to human error, and it can happen in a few key ways. Sometimes, it starts with a simple failure to recognize distress. A nurse or doctor just misreads the strip. That can lead to a delay in doing something about it, where the team sees there's a problem but just waits too long to act. And then there's this one, a catastrophic mistake, where the monitor accidentally picks up the mother's pulse, making everyone think things are fine, while the baby is actually in a deep crisis. And you know, sometimes the medical team can actually unintentionally contribute to the problem. Pitocin is a super common drug used to make contractions stronger. But if it's overused, it can cause the contractions to happen way too frequently, a condition called uterine tachysystole. The problem is the baby gets its oxygen between contractions, so if the contractions are piled one on top of the other, there's no time for the baby to get that oxygen. So what actually happens to a baby when these signals are missed? When the warnings go unanswered, it kicks off a truly devastating cascade of injury. While the signs of oxygen deprivation are often obvious right at birth, the baby might have really low APGAR scores, especially at the 5 and 10-minute checks. They might be born limp or blue, needing immediate help to start breathing. One of the most significant signs is seizures starting within the first day or two. And you might also see something called hypotonia, which is a floppy muscle tone. This whole cascade leads to a specific medical diagnosis, hypoxic ischemic encephalopathy, or HIE. It's a mouthful, but it's the clinical term for the type of brain damage that happens when the brain is starved of oxygen and blood flow. It's a direct result of that fetal distress going unanswered. And whenever these injuries happen, it brings up a crucial question that sits right at the intersection of medicine and the law. Was the standard of care met?
Now, the standard of care isn't about perfection. It's about competence. It's about what a reasonably skilled professional would do in the same situation. And when it comes to fetal monitoring, that means three things: using the machine correctly, interpreting the data accurately, and, most importantly, acting on that information in a timely way.
So how does that standard of care get broken? Well, it often comes down to some very human, very systemic problems. Things like inadequate training on how to read the strips, a breakdown in communication between nurses and doctors, or a really dangerous thing called alarm fatigue, where constant beeping just causes staff to tune out the real warnings. And that's exactly why the fetal monitor strip itself becomes so critical later on. It's the most important piece of evidence. It's an objective, minute-by-minute record of the baby's condition and what the medical team did or didn't do. The entire story is often written right there in that data. Which really leaves us with this final, crucial question. In an age of incredible medical technology, we can listen to a baby's most fundamental signal, its heartbeat. The challenge that remains is making sure that this ancient, vital voice is always heard.